Assalamualaikum and a very good day. I wish to our lecturer. We are from group 14 would like to explain on the application of 5R in using of the medication, and the medicine that have been assigned to us is Tramadol. But before we explain more on the 5R, let's take a look on the information about the Tramadol. The first one is the indication of the Tramadol, as it is used to treat moderate to severe acute or chronic pain due to the post-operative pain. Besides that, Tramadol can also be used to treat chronic cancer pain and analgesia or pain relief for patients with impaired renal function. So, what is Tramadol actually? Tramadol, which is an analgesic drug, is an opioid pain medication which is used to treat moderate to moderately severe pain. It can be taken orally and has immediate release formulation. It is also available by injection and needs to be prescribed by specialist doctor only. Someone who is taking Tramadol can experience side effects such as abdominal pain, confusion, nausea and vomiting, allergic reaction, dizziness, diarrhea, tachycardia, and sweating. Now, let's move to the 5Rs concept in medications. Someone may ask, what is 5Rs concept? So we, as a pharmacist, we should know that 5Rs concept is one of the recommendations to reduce medication errors and harm. The 5 rights should be accepted as a goal of the medication process, not the be-all and end-all of medication safety. This program had been started on 2013 and it helped to increase awareness regarding drug administration among consumers and healthcare. The first one for the 5Rs concept is right patient. It means that every pharmacist needs to double check the patient's name before administering the medicine. This will be further explained by Cikgu Atika.
Hi, meet Aisha. She is a pharmacist. So, as a pharmacist, Aisha wants to share info on medication for the right person. First, make sure you check your name and indication. Second, medication cannot be shared with people. And third, medication must be kept from reach of children. It is better to state your full name and your health problem upon receiving the medication because we want the medication is delivered to the right person. This is the example of label on the medication. Check your name carefully and your detail. Ensure it is correct. Why? Because there are many patients in pharmacies. Some patients may turn out with same names and pharmacists may exhausted. That is why, as a patient, you need to check your own medication details. This is example of common situation occur in our society. This girl Anna share her medication with her friends Ivan. Oh wait, no! This can't be happening. Anna cannot share her medicine with her friends. Because Tramadol is not an over-the-counter drug. The dose may be different. It can cause dangerous to Ivan. Besides, Ivan can get his own medicine. So for now, I am sure that you understand why it cannot be shared. Last but not least, please keep your medicine properly because your children might swallow the medication and can cause dangerous for them. Three things to be highlighted on medication for the right person, which is check your medication properly, do not share the medications, and keep the medicine out of reach of children. Look how happy Aisha is if every of her patients get the right medication.
The second one is right medication. The pharmacist must make sure that the drug is correct according to the diagnosis. This will be further explained by Kamel.
Bismillahirrahmanirrahim. I will explain another R in the 5R, which is known as the right drug. So what does it mean by the right drug? Right drug means that the patient must take the true medication for what disease that they have, and the pharmacist and also doctor must give them the true medication. So what happens if they take the wrong medication? They will not recover from their disease and may become more worsened, for example, cause death. So the drug that is given to our group in this project is a Tramadol. Tramadol is a drug that acts as a painkiller that helps to treat moderate to severe pain. And the person that need to take this drug is the person who have operation and serious injury. How to apply right drug concept in our daily life? The name of Tramadol must be written correctly and clearly by the pharmacist or the doctor that prescribed this drug. This is because patient will be more confident when taking this medication. What happens if Tramadol is spelled wrongly? So the patient might be unconfident to take this Tramadol and hence they will not be recovered from the pain and may also cause death. So the pharmacist and the doctor must spell the Tramadol correctly so that the patient might confident to take this Tramadol. Next, how we want to apply the right drug concept. So the pharmacist and the doctor that prescribe the drug must use generic name rather than the brand name. So what is generic name? Generic name is the chemical name of the drug. Meanwhile, the brand name is the name of the drug that is made by a certain company. Why pharmacists and doctors use generic name rather than the brand name? This is because they want patients be more familiar with the generic name as it is used all over the world compared to the brand name. Brand name is used only at a certain country. It means different countries have different type of brand. So this is example of the generic name for Tramadol is the Tramadol, and then the brand name we have Ultram, Tramal, and also hydrochloride ER. Lastly, to make sure the right drug concept is applied in our daily life, the strength of Tramadol must be stated clearly and correctly by the pharmacist or the doctor that prescribed the drug. And the patient also must take note what type of the strength that they will need to take, because if they take wrong strength, there will be unwanted cases occur to them. So, why does the strength of the drug is important? As example, in the Tramadol, it have very strength. It have two type, which is fast release type. It have 50 mg strength, while slow release type it have 50 mg, 75, 100, 150, 200, 300, and 400 milligram. Next, if the patient take the strength of Tramadol wrongly, there will be cases of overdose of the drug and also underdose of the drug. So that's why it is important for the pharmacist and doctor to state the strength of Tramadol correctly.
And the third one is right dosage. Pharmacists need to find the correct dosage for patients. This will be explained more by Alaina.
My name is Alaina. Today, I will talk about the right dosage. We need to find the correct dosage for patients. Why right dosage is important? First, to ensure the therapeutic effect of the medication. Second, to avoid overdose or underdose of that medication. Adult dose. For pain condition, patients need to take 50 to 100 mg orally every 4 to 6 hours. For those who do not require rapid onset, can start with 25 mg once daily. The maximum dose is 400 mg per day. For chronic pain condition, it has extended release and immediate release. Both start with 100 mg once daily, and the maximum dose is 300 mg per day. Geriatric dose. For pain condition, patient needs to start with low dose. Patient must over 75 years old, and maximum dose for immediate release is 300 mg per day. For chronic pain condition, we need to be careful with selection of dose, and the maximum dose for immediate release is 300 mg per day. For pediatric dose, this is not recommended for children. It must be 17 years old or older to give this Tramadol. Renal dose adjustment. For immediate release, creatinine clearance less than 30 ml per minute, we need to increase dosing interval to every 12 hours, and the maximum dose should not exceed 200 mg per day. And for the extended release, creatinine clearance less than 30 ml per minute, the use of Tramadol is not recommended. Liver dose adjustment. For immediate release drug, patients with cirrhosis need to take 50 mg orally every 12 hours, and for the extended release, severe hepatic impairment patient, the use of the Tramadol is not recommended. Precaution.
Patients who suffer from emotional disturbance or depression, head injury, history of epilepsy, CYP due to T6 intermediate and poor metabolism, elderly, pregnancy and lactation need to be careful when taking this tramadol. Dialysis patient. Patients who having hemodialysis can receive their regular dose on dialysis days since only 7% of dose is removed.
And the fourth one is right route. Pharmacists must ensure the correct route for the medicine to be administered to patient. This part will be explained by me, myself, Lisa. Next, I will explain on the fourth 5R, which is right route. Every pharmacist needs to inform the patient on what type of drugs dosage form that they will receive. This is because different dosage form will have a different route of administration, and in these cases, tramadol are available in two types of dosage form. Some patients may receive tramadol in oral tablet dosage form. But the most common one, they may receive tramadol in oral capsule dosage form. This is the label that the patient will see once they receive the medication, and this part can be related to right route as it can give the information on how the medication can be taken. As tramadol is an oral dosage form, so it must be taken orally, which is by mouth. But some patients may ask, can I crush the tablet? Can I chew the capsule? And the answer is no. They cannot crush the tablets nor chew the capsules. But why? This is because it can reduce the effectiveness of drugs, thus preventing it from reaching the appropriate site. Besides that, some tramadol are also designated in modified release form, as it is intended to be released slowly inside the body so that the chance of side effect is reduced. So, if the patient crushes the tablet, it causes the drug to be released very quickly, and this can lead to harmful effect toward the patient. In conclusion, every time patient receive this kind of medication, pharmacists should alert the patient that they cannot crush or chew the tablets or capsules, and the correct route to take tramadol is by swallowed it whole. Finally, the last one is right time. Pharmacists must ensure that patients never miss their dose. This will be further explained by Sarah.
So now we are moving on to the last point of 5R, which is right time. Right time is very important to ensure that patient never miss their dose. Patients have to make sure they take the medicine prescribed at the right time, whether before or after meal as instructed by the prescriber. We will discuss this further on the next few slides. Okay, as was mentioned previously, medicine have to be taken at the right time. How? Okay, you can take tramadol at any time, but try to take it at the same time every day, and make sure you space your dose evenly. Okay, as an example, if you have to take tramadol twice daily, which is you have to take 2 times a day, right? So you need to take it every 12 hours. If your first dose is at 8 a.m., then your second dose will be at 8 p.m. Another example is, if you have to take tramadol 4 times a day, then you have to take it every 6 hours. If your first dose is 6 a.m., then your second dose will be 12 p.m. And then the next dose will be at 6 p.m. and then 12 a.m. This can make it easier for you, and you will not be confused what time you have to take the medicine every day. You also must be curious whether you have to take your medicine before or after meal. So, as for tramadol, it can be taken with or without food. This is because tramadol doesn't usually upset your stomach, so you can take it with or without food. This is mean that you can take it before or after meal. But if you take it before meal, then make sure you take it before meal every time. And you have to make sure that you take it at the same time every day. What if you miss a dose? You have to skip the dose if it almost your next scheduled dose.
That's it from us. Hopefully, Doctor enjoy watching our presentation. Thank you.